In this video, we will discuss about the current challenges for the CAR-Ts to reach from preclinical to clinical stage, and what are the current stages, or what are the current status of this, some of the modifications that people are looking to do in this CAR-Ts so that it can improve the CAR-T efficiencies. In terms of this optimizing CAR designs, there are several designs that are undergoing intensive investigations, such as this binding domain, sickle chain variable fragment VHH, and this DARPin D domain hinge. And there are many co-stimulatory domains such as 41BB, CD28. However, some of them are able to reach to this clinical stage, that is under phase 1 and phase 2 and phase 3 and phase 4. For phase 1 and phase 2, the some of the most common uh, is CAR designs of are this D domain ligand based CAR design, receptor based this CAR, and the cytokine based CAR. And in the phase 3 and phase 4, these two of them are able to reach uh, at this stage, that is CD123 and CLL1 tandem. And in terms of this CAR expressions, that is by expressing the CAR whenever there is a tumors, this is reached only to this phase 1 and phase 2, and that too based on track promoter. And whereas in vitro, the inducible promoters are based on this TET or this doxycyclines. So instead of doxycycline, they use tetracycline, and this hypoxia indicator, that is HIF alpha. And some of the others promoters such as AAV-S1, CCR5 are also been also under investigations in this in vitro stage, and they are at in vitro stage. In terms of the boosting metabolism, that is making changes into the CAR T cells such that it can help in improving the anti-tumor efficacies of the CAR Ts. So these are still under in vitro stage because of their disadvantages or problems that can leads to the toxicity of the CAR T cells. And and in terms of this engineering strategies to make sure that T cells does not get deactivated, or to avoid the T cells dysfunctions, some of the strategies are able to get to the clinical stage, but most of them are still under preclinical stage, that is in the in vitro stage, such as immune checkpoint and these inhibitory receptors, epigenetic changes using TET2, transcription repressors, practicide, and many of these we have discussed in our previous videos. This practicides is the ability of the immune cells to kill another immune cells, and there is immune checkpoint inhibitors, and these are the receptors that are present on the immune cells and which are being taken advantage by the tumor cells to deactivate them. And so these things are still under preclinical stage. And in terms of the clinical stage, some of the things that are reached to the clinical stage are these surface expressed immune checkpoint receptors such as PD1, CTLA4, and some of these inhibitor receptors using the TGF BR2. It will prevent the TGF beta interactions with the CAR T cells. Here the disadvantage is also the same thing, the toxicities that might be caused by the T cells, and also this genetic instability which might cause a second malignancy, or could create a possibility of second malignancy. Last one is about this armoring T cells. And this armoring T cells is basically the things that we discussed in our previous video, that is improving the T cells trafficking by overexpressing the homing receptors and other receptors such as CCR, and also this degrading enzyme degrading upregulation of enzyme degrading proteins or enzyme, upregulation of enzyme uh, ECM degrading enzyme, upregulation of ECM degrading enzymes such as heparanase, CPNA, adenosine, demycin, and the modifications that reach to the phase 1 and phase 2 clinical trial are these receptors of regulations such as CXCR4, CD4OL, and also the switch receptors TIGIT, CD28, secretion receptors such as alpha PD1, IL7, CCL19. So these are some of the receptors that have made to the preclinical stage. However, the disadvantage here is also the same. Since we are doing the genetic modifications, it might cause instability and possibility of secondary malignancy. So I hope you understood some of the current challenges for the CAR-Ts, and in different aspect of these CAR-T modifications, uh, which of them are at preclinical stage and which of them are at clinical stage. You might have also got a basic idea about that. If you need to understand more about this topic in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.